confused. Okay, hello and welcome to today's Ethnic Media Briefing. I'm Pilar Marrero, Associate Editor of EMS and your moderator for today. The House of Representatives last month proposed an $800 billion slash to the Medicaid budget, the largest cut in the history of the program. The Senate is poised to consider a similar measure in April. Medicaid covers more than 70 million people in the US, including 40% of all children and 60% of all nursing home residents. The proposed cuts would disproportionately impact Latino and Black families. More than 20 million Latinos, 13 million Black people, and 3.5 million Asian Americans rely on Medicaid. Many million white Americans also relied on Medicaid. 31 million children are covered by Medicaid through the Children's Health Insurance Program called CHIP. And in California, Medicaid, as you know, is known as Medi-Cal. Speakers this week will discuss the proposed cuts and its impact on low-income working families, children, and the elderly. Our guests today are Joan Alker, Executive Director of the Center for Children and Families and research professor at the Georgetown McCourt School of Public Policy Foundation. Stan Dorn, Director of Health Policy Project at Unidos US. Joan Priest, Director of Government and External Affairs, the Community Clinic Association of Los Angeles County. And Anthony Wright, Executive Director of Family USA. We are really honored to have all of you today. Reporters, please enter your questions in the chat and we will take them in order as time permits. So we begin with Stan Dorn, who will provide an overview of the proposed cuts to Medicaid and its impact to certain demographic groups. Go ahead, Jen. Go ahead, Stan.
Thanks so much, Pilar, and thanks so much to all of you for taking time on a Friday to cover this important issue. You really put your finger on the gist, Pilar, which is that the House budget resolution, which passed by a single vote, it passed by a straight party line vote. Every Republican but one voted for it. Every Democrat voted against it. Would make enormous cuts to Medicaid, to other health programs, to food and nutrition programs. We've estimated that these Medicaid cuts are larger than any that have ever been made in U.S. history by considerable margin. The SNAP cuts, likewise, the largest that have ever been made, larger than any that had ever been made. And just a word, and so what I'd like to do is talk about, what these cuts mean in terms of the budget process federally, and then who are the families who are placed at risk by it, and then talk a little bit about the politics and where we go from here. So the budget process that we're engaged in right now is a two-step process. Budget resolution, which is where we are right now, and budget reconciliation. And what makes this process important is there are special fast-track procedures that enable these kinds of bills to pass quickly and without resistance. So most bills nowadays have to get 60 votes in the Senate to pass, which means you need Democratic as well as Republican support. Not so with these bills. They can pass entirely by Republican votes alone. So as a practical matter, this is the only way Congress is going to be able to make major cuts to programs like Medicaid and SNAP and other programs that low-wage working people, middle-class people rely on, because they can do it without Democratic votes. So the stakes are very high. This first step, the budget resolution, the way that works is it sets the overall numerical targets. It says, Committee X, you need to save $880 billion. Committee Y, you need to save $230 billion. And once both House and Senate agree on those overall dollar targets, then the budget reconciliation process begins, where the committees that are in charge of Medicaid, in charge of SNAP, in charge of taxes, make the specific changes to the law that fit those dollar targets that they got assigned to. So right now, we're just looking at the total numbers. And once they settle the numbers, then all the various committees will be doing the specific details about cuts. However, Washington is a town that leaks like a sieve. And so we know some things that they're considering behind the scenes, and I'll talk about some of those. So, but the magnitude of the cuts is just extraordinary, and nothing in American history has been remotely this size. The closest previous cut, largest cut in the past that we had was a reduction in federal funding in 1981 that the Reagan administration, and it's an official evaluation, said resulted in a 13% drop in Medicaid enrollment. And that would translate into a 9 million person loss today. So, the advocates for these cuts, the Republicans, are saying, oh, this is all waste, fraud, and abuse. There's no way you can cut huge amounts like this from the Medicaid program without hurting millions of people. And the reason why they're doing this is because it will help pay for tax cuts. The Trump 2017 tax cuts that primarily benefited large corporations and the wealthy will expire after this year unless they get continued. So Congress wants to continue them. That will cost, almost $5 trillion, according to the Congressional Budget Office. They need to find a way to pay for it. The way they're going to pay for it, if under their plan, would be to cut healthcare and food and education and other programs that working people and middle class people rely on, and shift the money over to pay for tax cuts that primarily benefit large corporations and the very wealthy. So that's the overall game plan. It's spelled out in black and white in this budget resolution. And exactly as Pilar said, people of all races and ethnicities will suffer. They are at risk by these cuts. But communities of color are especially vulnerable. So we did a report of 11 organizations, including United US, but a bunch of other organizations that are, civil rights groups, health equity groups, did a report that analyzed the impact on communities of color of these cuts. And Pilar gave you some of the key stats. I'll give you a few more, just building on that. More than 20 million Latinos have Medicaid as their source of health insurance today. That's almost a third of everyone in the Latino community. It includes half of all Hispanic children. So if Medicaid is cut, Latinos will pay a heavy price. African Americans, more than 13 million African Americans have Medicaid as their health insurer. That includes almost 60% of all Black children and more than a third of all African American adults age 65 and older. So these are folks who rely on Medicaid for home care, for nursing home care. And if Medicaid gets cut, where will they be? 4 million or so Asian American Pacific Islanders rely on Medicaid for healthcare. 700,000 Native Americans. Some estimates go as high as 1 million, including 60% of all Native children and 40% of all Native adults age 65 and older. So the risks are enormous for communities of color. What are the kinds of cuts that are being discussed behind the scenes? Well, a number of things. One is they're talking about proposals that would terminate Medicaid for people who do not meet onerous work requirements. And, this has appeal in theory to many people, but in practice, what we've seen is it doesn't mean any improvement to work. It actually reduces employment, because when you take healthcare away from people and they can't get their health problems addressed, they are less able to work. It just is not a matter of common sense to say the way we're going to help you work is by making you sick. That is not what anybody in America voted for. And what's happened in reality is that people with disabilities have lost their Medicaid. People who are taking care of small children or taking care of aging parents have lost their Medicaid. People who are working have been terminated because they didn't hear about the policy or didn't fill out all the paperwork or couldn't get through on the phone lines. And so, we know that a quarter of the people in some of the states have been subjected to these policies have lost their coverage, and it's not been the people that this policy would have serious unintended consequences. So that's one example. Another example is that some Republicans are talking about ending states' ability or greatly cutting back states' ability to raise their own share of Medicaid dollars by taxing insurance companies and hospitals and others. And so the way Medicaid works is it's a combined federal-state program. The state puts up a certain amount of money, the feds put up a certain amount of money. If states can't raise money anymore the way they have, and every state but Alaska uses these taxes, that means the state money goes away and also the matching federal dollars go away. So there would be a huge cut to federal Medicaid financing, which inevitably means millions of people get cut off the program. Other things that are being contemplated are putting a rigid limit on the total amount of federal money that a state can get per person. And that kind of cap, all of these things shift costs to the states. If the feds pay less money for Medicaid, then what that means is the state has to decide, do we put in our own money? Well, if we do that, that means we're going to have to cut K-12 education. We're going to have to cut police, roads, fires. And as a practical matter, states are having a lot of budget troubles right now. Shifting costs to the states is going to mean nothing more than a cut that the state officials take responsibility for, not the feds. So the good news is that Congress is very nervous that taking Medicaid away from millions of people could be harmful politically. We know that huge numbers of people in every congressional district rely on Medicaid for their health insurance. And so there's a very bizarre circumstance when the House budget resolution passed, where many Republicans who won by narrow margins said, oh, we don't want to cut Medicaid. We don't want to cut Medicaid or SNAP. We're not in favor of that. And then they voted for a budget resolution that did exactly that. And they said, well, we were told that there won't be cuts really at the end of the line. Well, we'll see whether there are cuts. And the efforts will be made by Republican leadership to call these things anything but cuts. Oh, it's waste, fraud, and abuse. In reality, it means fewer people are going to get health insurance. People are going to get fewer benefits. People are going to have less access to providers. The bottom line is last November, people voted for their leaders to lower their costs. Costs are going up. They're still going up. They didn't come down on day one, as we were promised. And taking away health insurance, leaving people subject to medical bills without the protection of Medicaid health insurance means costs go up, not down. This is the exact opposite of what was promised to the American people. And this is all being done to take resources away from working people and middle-class people and give them to giant corporations and billionaires so they can buy more yachts and jewelry. And that is not what America wants. That is not what America voted for. And, we'll see how this plays out.
Thank you, Stan. We will hold the questions because I feel that speakers are going to address many of the questions that are going to come up. So let's just go through the speakers, and then at the end, we can have questions for all of them. Okay, guys? So let's just move to Joan Alker, who will discuss Medicaid and the Children's Health Insurance Plan, also known as CHIP. Joan, please go ahead.
Thank you so much, Pilar, and it's wonderful to be again with Ethnic Media Services and speak to you today about Medicaid and the Children's Health Insurance Program. I'm mostly going to speak to you about Medicaid because the Children's Health Insurance Program, or CHIP, just sits on the shoulders of its much larger sister program, Medicaid. And so for children, especially, Medicaid is really the big question here, and CHIP runs off of Medicaid. So let me start by just addressing a question came up in the chat. Medicaid is the federal program. Many states have different names for your Medicaid program, as exemplified by Medi-Cal in California, but they are one and the same. And I just want to talk to you today about the key roles that Medicaid plays in our healthcare system. First, Medicaid covers nearly half of all children in the United States. And Medicaid also covers 41% of all births. So you can see how tremendously important Medicaid is for families. Medicaid also covers the majority of seniors in nursing homes. And this is another important feature of Medicaid, to understand how it makes many parts of our healthcare system work, so that if you cut Medicaid, other parts of our healthcare system won't work as well either. So for example, Medicaid helps Medicare work, because the lowest 20% income seniors on Medicare have Medicaid too, to help them pay for their Medicare costs, which would otherwise be unaffordable. And because Medicare has no long-term care benefit, Medicaid pays for the majority of long-term care in this country. So 5 out of 8 seniors in nursing homes are covered by Medicaid, not Medicare. And similarly for children, Medicaid acts as a primary payer for the vast majority of children in low and working moderate wage families. And it also acts as a wraparound coverage for children with serious disabilities. So their families may have employer coverage, but those benefits aren't good enough if you have a child who has a very serious condition. And that's where Medicaid comes in. Medicaid is also vital for low-wage workers around the country. It's vital for people with disabilities. It is the #1 payer for behavioral health and mental health services. And it's also disproportionately important for rural communities. And rural communities face a lot of pressures on their healthcare system. Rural hospitals are closing at fast rates. Many communities have already lost the ability for women to have babies in those communities because their labor and delivery units are closing, and they have provider shortages. So rural communities are even at greater risk from these Medicaid cuts that Congress is considering. And I'll be brief. I'll just finish up making 2 points. Stan has spoken about some of the proposals. They're quite complicated. They're all moving parts. But the bottom line is this: states will not be able to make up for these large federal cuts. Even a state that wanted to could not raise taxes enough. And Medicaid is the largest source of federal funds coming into states. So this will have ripple effects on all areas of state budgets, not just Medicaid. And many states are talking about cutting taxes, not raising them. For example, in Florida, Governor DeSantis is pushing to get rid of all property tax, and there's already no income tax. So it is just not accurate to say that states will be able to make up these large cuts. So states will be left with some very bad choices. We have an aging population, and Medicaid is, as I mentioned, the largest payer of long-term care. We have an aging population, and states will be faced with pitting very, very vulnerable populations against one another. An aging population who needs long-term care, children and families, people with disabilities. And they will either have to cut people off, reduce their benefits, or they're going to have to cut payments to providers. And particularly providers that are seeing community health centers, rural providers, as I mentioned, providers who see a lot of patients who are uninsured or underinsured are especially at risk from those provider cuts. That's the reality. And the last point I want to make is that we are hearing a lot about fraud. Well, we don't have to cut anybody on Medicaid. We just can get rid of the fraud. Well, that's also read the words that they put on paper. Okay, what are they putting on paper? Everybody wants to get rid of fraud. There's no disagreement there. Nobody likes fraud. If you want to address fraud, and you look at where fraud occurs in the Medicaid program, people who are enrolled in Medicaid are the victims of fraud. They are not the perpetrators. So proposals that limit people's access are not addressing fraud. Proposals to address fraud would include hiring more prosecutors at the Department of Justice, beefing up state fraud control units. That's how you address fraud, and that would be great. Everybody's for that. These are not proposals to address fraud. They're proposals to cut Medicaid. Thanks. I'll hand it back, Pilar.
Thank you, Joan. Let's go to Joanne Priest, who will discuss the impact of cuts to community health clinics. So, Joanne?
Thank you, Pilar, and good morning, everyone, or afternoon. Happy to be with you. Thank you, Joan. You queued that up perfectly. I'm here to talk about the impact of these Medicaid cuts on community health centers. As was mentioned, the impact will be felt really strongly by providers who serve a large portion of Medicaid patients and who serve a large portion of uninsured patients. And that is community health centers. Nationally, community health centers serve 32.5 million patients. In California, where I am, health centers serve 7.8 million patients. And here in Los Angeles County, community health centers serve over 2 million patients. By mission and mandate, health centers serve everyone. We are here to serve children, parents, working people, future parents, students, seniors, veterans. Health centers serve individuals with disabilities, individuals experiencing homelessness. By their very design, health centers are located in medically underserved communities. They serve the very places and people who struggle to access care the most, whether they struggle to access care because there are no other providers, which we see in many more rural places, or because they struggle to access care, they can't find providers who speak their language or who are familiar with their culture and their background. So health centers in many places are their patients' only source for accessing high quality care. Here in Los Angeles County, where I'm located, our organization, the Community Clinic Association of Los Angeles County, represents 66 health center organizations. Collectively, as I mentioned, they serve over 2 million patients. 78% of patients served by health centers here in Los Angeles County have publicly funded healthcare coverage. They're covered by either Medicaid or Medicare. 74% of patients are low income, defined as under 200% of the federal poverty level, and cost of living here in Los Angeles is quite high. 200% of federal poverty level is a very hard income for anyone to exist on. I'll note, because of Medicaid expansions, Medicaid is so important for health centers, whether from the Affordable Care Act implemented in 2014 or further expansions we've done here in California. In a little more than a decade, health center patients in Los Angeles County went from majority uninsured to majority insured. In 2011, 58% of patients served by health centers here in LA were uninsured, almost 60% uninsured. Today, 2023, only 14% uninsured. There's a dramatic difference, and it's had a dramatic impact on patients' ability to access care and on health centers, their organizations, and their infrastructure. On the patient side, I think our other speakers have covered this, what the impact would be. As I mentioned, most health center patients are covered by either Medicaid or Medicare. In LA, we're very heavily Medicaid. 72% of patients here in LA are covered by Medi-Cal, what we call, of course, Medicaid here in California. So this impact would be dramatic. In California, it's 67% Medicaid, and health centers nationally in the whole country, 50% of their patients are covered by Medicaid. So when we're talking about providers serving this large portion of Medicaid patients, it will be felt very strongly by community health centers and by their patients. Medicaid coverage provides patients with access to a full range of medical mental health services, goes far beyond the services that health centers are able to access when they're uninsured. Having Medicaid coverage enables health centers to refer patients for specialty care, for management of complex conditions, covers hospitalization, all things that when patients are uninsured are extremely challenging to access for patients. So Medicaid really having that coverage is a game changer for patients and the types of services that they're able to access to take care of the full range of their medical needs. As Joan said, I think our three-legged stool, Medicaid funding cuts will inevitably result in less people covered, fewer covered benefits, and quite likely a reduction in reimbursement paid to providers, which will harm the entire system. For the health of patients, we know when patients are uninsured that they're more likely to minimize or delay care. They have fears related to costs, and this just leads to worse health outcomes in the long run. It leads to folks relying on emergency rooms for care, which isn't good for anyone, and it's far more expensive in the long run. And work requirements were met. I think when health centers think about the potential for work requirements being added to Medicaid, I think the first reaction is, our patients work? We see that every day. So most of our patients do work. And as was mentioned, what work requirements will do is essentially just cause people to lose coverage. And most of the time will cause people to lose coverage that they're still eligible for. We just have a new layer of bureaucracy. We have more paperwork, more requirements, more systems to navigate. And health centers try to assist patients with all of this, and it's already challenging. This will make it even more challenging for people to retain the coverage they're eligible for. And I'll close with just talking about the impact on health centers as organizations, as providers of primary health care, trying basically to keep the lights on, the doors open, and keep their staff employed. Health centers receive some federal support, but they depend on other revenue sources. It varies significantly regionally and across the country. Nationally, 43% of health center revenue comes from Medicaid. Here in Los Angeles, it's 55%. So over half of the revenue that health centers are depending on is coming from the Medicaid program. It is the largest funding source for most health centers and very challenging to backfill should this funding go away. Medicaid provides financial stability. So health centers, when you've got Medicaid patients, we saw a sea change just from the implementation of the Affordable Care Act and people gaining coverage. Health centers became more financially stable when their patients have coverage and are not uninsured. Financial stability enables growth and expansion. This enables community health centers to open new sites, provide new services, start new programs, new initiatives to support their patients' health, and to hire new staff and do really new innovative things to care for their patients. Cutting Medicaid, like we said, will cause patients to fall off of coverage and will jeopardize the financial stability of community health centers. Destabilizing health centers will force cutbacks in services. You'll probably see health centers forced to reduce operating hours, or maybe I can't stay open in the evenings and on the weekends anymore. I've got to cut some of those extra programs. Maybe I'm not going to hire new staff. Maybe I can't afford to anymore. So really the impact on community health centers has the potential to be very significant. So from a patient care perspective, access to care, coverage, but also just the fiscal stability of community health centers, the very entities that are supposed to be there in our communities, providing high quality care to everyone who walks through their door, will really feel the pain of Medicaid cuts. So really, really hoping that we can all work together and push back on this, because it will be devastating to the patients and to the organizations serving them.
Well, thank you. Thank you for that. And we'll just go ahead and take the last speaker and then open for questions. And the last speaker today is Anthony Wright, Executive Director of Families USA. Hi, Anthony.
Hey there. Thank you for having me. Again, I'm Anthony Wright. I'm the Executive Director of Families USA, the longtime healthcare consumer advocate. I come to this work after 3 decades of doing healthcare consumer advocacy at the state level, including the last 2 decades previously in California, where I work with many of you, see some familiar names. Great to see you and see your faces and names. And and thank you for joining us on this really important conversation about about the severe impacts of cuts to Medicaid, which would directly harm the health and economic vitality of every corner of our country. These proposed hundreds of billions of dollars of cuts would disproportionately impact rural areas, veterans, children, people with disabilities, the elderly, and communities of color. Despite many of these same working class voters becoming a swing constituency, being a constituency that both parties say they are seeking to represent, that's who will be directly impacted by these cuts. Last November, people voted with their wallets, seeking greater affordability, including for healthcare. But the cuts proposed in the budget resolution passed just a few weeks ago would shred our safety net, and it's the opposite of what voters called for. Not just forcing families to lose coverage and access to key healthcare services, but shifting costs onto people who are already struggling with costs for everything else. So we are Families USA, working with the groups also on this call, are very committed to trying to stop these cuts or delay these cuts or mitigate these cuts, because cutting away at the healthcare lifeline for low-income families living paycheck to paycheck is cruel and counterproductive to the affordability that Americans voted for. These healthcare cuts will impact all of us and the healthcare system we all depend on, regardless of our race or ethnicity, or who we voted for, or even whether we have Medicaid coverage. Cuts of hundreds of billions of dollars will harm the hospitals and, as we just heard, the clinics and the health services in all our communities. And all of this is to fund a tax cut geared toward the wealthiest and corporations. We do not have to do these cuts. This is a choice that in order to pay for massive tax cuts to corporations, we are making cuts to the core financing program for the healthcare system of the most vulnerable and for all of us. New polling tells us that nearly 75% of Americans agree that Medicaid is very important to their local community, and that includes over 60% of Trump voters. And the Medicaid program is widely embraced and felt. It is now bigger than Medicare, with nearly 73 million people, and if you include the CHIP program, 80 million folks. That is bigger than Medicare, which is around 67.5 million people. It has only grown since 2017. And so a recent Kaiser Family KFF poll suggested that about half of us are on Medicaid, have been on Medicaid, or have a close family member who has been on Medicaid, and have a person, somebody who has a close personal connection to us. It could be a daughter or a niece. It could be a grandmother in a nursing home or getting home care. It could be an uncle getting rehab to be ready to re-enter the workforce, or an aunt with chronic conditions. So I think one of the main points I wanted to make amongst the great information you've been already given is how much that even if we do not directly depend on Medicaid, how much it matters. Because even if we do not directly depend on Medicaid, our local hospitals and clinics do. The American people realize that our healthcare system is stronger when everybody is getting primary and preventive care, and when they have to go to the hospital, that they are a paying patient covered by Medicaid rather than being uninsured. The overwhelming majority of us understand that Medicaid is a community pillar, providing for millions of Americans, nearly half of them children, and nearly half of our children, and almost half of all births. Medicaid provides for the services, the checkups, the well child visits that keep kids to stay healthy in school and ready to learn. With Medicaid, kids miss fewer school days, graduate high school, and earn more as adults. Parents and caregivers are able to focus on their families, on what matters most, rather than constant worry of putting food on the table or affecting medical care. And older adults, our parents and grandparents, have the support that they need for long-term care or for to live comfortably and with dignity in their own homes. I'll say this personally. I happen to live and have intimate knowledge of two of the congressional districts with the highest Medicaid enrollment. I grew up in the Bronx, New York, and one of the poorest congressional districts in the nation, where the Medicaid enrollment is over 2/3 of the over 70% of the population. The other highest congressional district in the nation is in the Central Valley of California, where an area where I've lived for the last 2 decades. One was where I grew up in the Bronx was represented by a Democrat. The Central Valley area that I was talking about is represented by a Republican, Representative David Valadao, also with over 2/3 of that district on Medicaid coverage. But even if you aren't covered by Medicaid, if you live in those areas, what happens if that source of coverage, Medicaid, is cut by hundreds of billions of dollars? What happens to the hospitals in that area? What happens to the clinics in that area if the major funding source for those hospitals, for those clinics, is cut severely? That means that means reduced services. That means maybe they need to close the maternity ward when at a time when we're already seeing growing maternity care deserts. Maybe that means that a rural hospital closes, like happened in California Central Valley just a year or two ago, that thankfully has been reopened, but that institution would be threatened again if these cuts were made. So what happens to those economies? The impact will be major, not just in those districts which are 2/3 Medicaid, but also in the districts which are 1/3 Medicaid, since that's still a sizable percentage of the population and a sizable percentage of the financing for the healthcare system that we all rely on. So the other thing I want to make clear, and I think my colleagues have talked about, is that this is a little bit of a different fight than 2017. Number one, a lot more people are on Medicaid. We've had multiple more states expand coverage through the Medicaid program, including through state plebiscites, through state votes, even in very red states. So there's millions of more people on Medicaid, dependent on Medicaid, than in 2017. But the other thing is political, which is that unlike in 2017, we saw a full frontal assault on the Affordable Care Act, with proposals to repeal and replace very explicitly. Now the House leadership is trying to mask the Medicaid cuts, even though the cuts proposed are at the same scale as the ACA repeal, but just without any replacement. So I want to be clear about this, that if there are they're not going to say that it's Medicaid cuts. They'll talk about waste, fraud, and abuse. They'll talk about other things. But this is the same scale of impact of what we're talking about. This is they're not going to say that they want to cut Medicaid, but they're going to have it in the proposal. Even their budget resolution, they say, "Oh, Medicaid is not listed. The word Medicaid is not in the budget resolution, but there's $880 billion of cuts in the committee that oversees Medicaid and Medicare, and there's no way to make those cuts without cutting those programs." And so they may call it different things, like work reporting requirements, but if you impose bureaucratic barriers like reporting requirements that force families off coverage, that harms the healthcare system for all of us. If you cut and cap the formulas or funding streams to states, that just shifts the cost to strapped states that will be forced to make a Sophie's choice of either cutting coverage or benefits or services. That's a cut to the healthcare system that serves all of us. So a cut is a cut is a cut, and a cut to all of us. So whether it's that local hospital that's forced to shut down its emergency room or scale back other services, or the community clinics and rural hospitals or long-term facilities that are already threatened and may not be able to keep their doors open, or the ER that has to add hours to its wait times, these Medicaid cuts will be felt by people in every state and every congressional district in the nation. And so that's why we should all care about these cuts, because this impacts us all, regardless of our race, our ethnicity, our party, our health provider, or how we get covered. Of all these issues, this is the fight, whether we literally, as well as figuratively, whether we care for one another. So we're committed to be in this fight. We're happy to be with our colleagues here, and I'm happy to take any questions with my colleagues. Thank you.
Thank you. Thank you, everyone. And yeah, there are several questions in the chat. There's a few questions regarding the impact. Of course, you've all talked about impact, but there's also questions about what can be, what are the alternatives? What can be done? Can the Democrats do anything? So one of you already said they can't do anything because they're in the minority. Is there a way to stop this? What is the citizens' way of, and what is the media's way of having, their voices heard on this? Because they're saying it's not happening because they know it's unpopular, right? So how do we do it? Stan?
I think Joan raised her hand before me. I'll let you go first.
Hey, Joan. I just saw yours first.
Yeah,
Joan, please go ahead.
Just quickly, I wanted to pick up on Anthony's point that this is not a done deal. That's the most important takeaway. This is not done. There will be many months of discussion right now. So educating your readers about this issue is critical right now, so that people can share their opinions with their members of Congress, because this is not a done deal. And we know, as Anthony mentioned, that the majority of Trump voters do not want Medicaid to be cut. This is not popular with voters of any party. So it's just important to educate folks and encourage them to make their voices heard.
Stan?
Yeah, I agree completely. The Republicans can pass this legislation by straight party line vote, but they may not be able to. If they lose just 2 votes in the House of Representatives, they won't be able to pass legislation. And the House budget resolution passed in late February by literally a 1-vote margin. So if there are 2 or 3 members of Congress who won election by narrow margins last time around, and they're worried that this might vote for Medicaid cuts might cost them their seat, if 2 or 3 of them vote against the cuts, they won't happen. So there's, and there's, and in terms of the role of the media, I think it's Anthony put his finger on something really important, which is they're trying to play hide the ball. They're trying to say, oh, we're not cutting Medicaid, we're just cutting waste, fraud, and abuse. No real human beings will be hurt. And the media, I think, can play a really important role in sort of getting beneath the surface those claims, those superficial claims, and asking what exactly is being proposed, what exactly would the impacts be? Because in truth, there's no way you can save huge amounts of money to fund tax breaks for the wealthy unless you take healthcare away from millions and millions of working people and middle class people.
Yeah, and I'll just add that this is an ongoing fight. These cuts have not been made yet. But they are. So we don't want to tell people that they're happening. It's a fait accompli, and actually scare people from using the care that they are entitled to right now. My advice to people from a practical point of view is, if you're not already on the if you're not already getting healthcare through these programs and need healthcare, go sign up, take advantage of the healthcare that's available, and then fight like hell to preserve it. And the issue of having, whether it's citizens or members of the media, ask their members of Congress where they are in these cuts is really important. I have a document that I can send to any reporter of over 24 members of Congress who say they do not want to cut Medicaid. But then then they sometimes get squirrely about, well, maybe asterisks, maybe we'll do waste, fraud, and abuse. So asking them about what they mean by waste, fraud, and abuse, because some of them will then go into, well, we think that there's something fraudulent about some of these formulas. We want to change the formulas, and say, well, that means that a state will lose billions of dollars, and then will be forced to cut benefits, services, or people. What is it? Like, what is the actual mechanism for that? Like pinning them down on this so that they do it, because the more that they're right now in the discussions about how they craft this big budget bill, this big budget reconciliation bill that because it's a budget reconciliation bill, does not need cannot be filibustered. So there is no Democrat. It has to be the Republicans. But their margins are so slim that if enough Republican members go to their leadership and say, don't make us walk the plank on big Medicaid cuts, that will hurt our districts too much. That is what we're trying to do right now, and that's what people need to do. That's what people need to do as citizens, as journalists, as advocacy groups, etc.
So there's a question in test saying, what steps can individuals and advocacy groups take? Well, I hear there's a lot of people calling their congressmen. There are people going to town halls. There are people complaining, and these complaints are getting to the ears of the congressmen and the senators. And that's how they start questioning whether or not they're going to vote for this, right? I mean, what else would you recommend? Anyone?
I mean, I think like covering this issue and highlighting it, because I think, let's also face it, we are in a very crowded media environment with so much else going on.
Yes.
Things going on in DC, but there's a lot of things that the Trump administration is doing that's getting a lot of attention. And this is the one thing where he absolutely does need Congress to do. He cannot do this unilaterally. So this is where having coverage on the broad issue of healthcare and educating people about the benefit of Medicaid is really important. Most people don't know everything that Medicaid does, that it's not just a support, not just for low-income kids, but families, that more veterans get healthcare from Medicaid than from the VA. More nursing homes get, it's the biggest funder for nursing homes in many cases. It's the biggest, I think most people don't know that, so educating about that. But I think but also not just talking about it broadly, but specifically about what will Representative X do on this vote is a highlight, key, seminal thing to be covering and focusing on as part of an ongoing effort to educate about Medicaid and the ACA in general.
Yeah, so just we understand, some people have this misguided idea that Medicaid does not affect them. Cutting Medicaid will not affect them because maybe they're on the ACA or maybe they have private insurance. The reality is that it will affect hospitals, like Joan mentioned. Many hospitals are on the brink and will likely, suffer a lot. Even people who are not directly getting Medicaid will be affected. Do you all agree? Does anyone say this and agree to this?
Yeah, I think that's exactly right. I just as one example, I remember California made major cuts to Medi-Cal, its Medicaid program, in the early 1980s. They and terminated a lot of people who are now covered under expansion. And Los Angeles County had one of the best trauma care networks in the world. Within a year or two of the Medicaid cuts taking place, that trauma care network was in shambles. And there were huge swaths of the county where people could no longer get to the hospital within the golden hour, that quick period of time that makes a difference between life and death. Didn't matter if you were an executive earning millions of dollars up in your office on the top floor of a skyscraper in downtown Los Angeles. If you had a heart attack, you were at greater risk of death because your neighbors didn't have Medicaid anymore. So the healthcare, and Joan was talking about all the hospitals that have closed, the maternity care capacity that has now disappeared from much of the country. If if the healthcare system doesn't get the resources it needs and it has to contract, it places all of us at risk.
And Joan Alker, how will children access healthcare if they lose Medicaid, Chip?
Yeah, I think it's important to note that the proposals that are being made, those that are in favor of them are saying that it's not going to hurt people. So they're not proposing any alternatives. It's not like they're saying, oh, we'll take away your health insurance, but we'll give more money to Joanne's clinic so that they can treat people who become uninsured. That's not what they're saying. They're just talking about pulling money out of the system. So, but the way they're talking about it, as I said before, is that they're attempting to say that it won't hurt people, that it's merely pulling fraud out of the system.
Yeah.
And that's just not correct. And as I mentioned, if you want to address fraud, let's do it. We've got a lot of prosecutors leaving the Department of Justice. Let's get them back and reassign them to Medicaid and Medicare fraud. So, so that's the reality here. There isn't any other way in this country, in the United States. If you don't have health insurance, it's the price of admission to our healthcare system. And if you don't have it, you don't see a good show. It's as simple as that.
And we will see an increase in the uninsured.
To build on Joan's point, those alternative sources of care for people who don't have health insurance, they will be weakened by these proposals. If you don't have health insurance and you want to turn to a community health center, you're going to find that they've had to let a lot of staff go. They've had to close down some particular kinds of service lines they've offered because they now have much less Medicaid revenue than they did before. If you have an emergency, hospitals are legally obliged to provide you with stabilizing care. But if your hospital emergency room isn't open anymore because they lost a lot of revenue, you can't get that care. So the plans that have emerged in Congress leave people with no path forward. And we know the impact will be horrific. In the past, we've done studies in America, and we found that when people lose Medicaid, people's financial circumstances worsen to the point that there's a 25% increased risk of eviction. That's in the report that we released along with Anthony and a dozen other groups that are focused on health equity and civil rights. We know that in many cases when people with chronic illness lose Medicaid, their mortality rates go up because they can't get their prescriptions refilled. They can't go to the doctor for checkups. Women with breast cancer that's developing don't get it picked up because they can't afford to go to the doctor, and it's not diagnosed until it's too late to treat effectively. So the consequences are really, literally deadly and financially destabilizing for millions of people.
What is the timeline on this? When are things moving in Congress, and by when should we expect this to move forward?
So the budget resolution passed just a couple of weeks ago in the House. It is the question of what happens in the Senate, and those are discussions that are ongoing. If you were to believe Speaker Johnson and his timetable, they would move quickly in the next couple of weeks on a budget resolution. Committees would set whatever the number is, whether it's 880 billion or another number. Frankly, anything that's in the hundreds of billions would be devastating to Medicaid, and then they would decide what are the cuts to implement that, including whether it's work reporting requirements, formula changes, per capita caps, block grants, whatever they decide to do. Frankly, something at the scale we're talking about is not just one of those options, but multiple of those options making cuts. And then that they would put that together in a budget reconciliation package that also includes tax cuts and other things. And again, according to Speaker Johnson, he wants to get this all done by have it done and signed by Memorial Day. It is likely that will spread out, but I don't want to lose the urgency of this moment, because frankly, if it actually gets to a place where there's a vote, there will be so much pressure by party leaders for Republicans to just vote, especially on something that is funding sort of key priorities of that of the party, including tax cuts, right? There will be just so much pressure. Elon Musk has said he will fund he will use his money to fund primary challenges for anybody who votes against that budget, etc. So this is the time now for senators, for House members to go to their leadership and say, "Don't make me walk the plank. Like I don't want to have this included in the package of votes, because if we get to the point where there is actually a package that actually has the cuts spelled out, that will be too late."
It'll be too late.
I'm not going to say it's too late because we'll always fight, but that will be a lot harder to for the fight. And so just to give you an example, because you asked what we could do, right before the vote on the budget resolution, there was a letter from the Congressional Hispanic Conference, which is the group of Republicans that represent heavily Latino areas. And they wrote in a letter to Speaker Johnson that said, quote, "The House budget resolution proposed $880 billion in cuts under the jurisdiction of House Energy and Commerce, with Medicaid expected to bear the brunt of those reductions. Nearly 30% of Medicaid enrollees are Hispanic Americans or from families across the country. Medicaid is their only access to health care. Slashing Medicaid would have serious consequences, particularly in rural and predominantly Hispanic communities where hospitals and nursing homes are already struggling to keep their doors open." Like, this is a letter by Republican Congress members to their leadership. So the question is, for the members who signed this on, whether it's signed on to this, okay, you voted for the budget resolution, which is true. For the members who represent Latino or frankly other ethnic communities, why aren't you on this letter? Or why weren't you on, or why shouldn't you be on? Like there is lots of opportunities and to use these like efforts to say, where are you on this right now, and what are you doing to work with the colleagues? Because some of them have identified themselves as concerned. The question is, can we transfer that concern into?
Can they actually vote against it? I mean,
yeah.
Will they fear more? What would they fear more? People voting them out of their districts, or Elon Musk funding a primary opponent?
Right.
I guess that's the question. Let's just
go
around.
If I could, and one other question is, hey, you sent this letter saying that you were worried about cutting Medicaid. It would do terrible things to your district. So why did you vote for a budget resolution that made $880 billion in cuts to Medicaid? Simple question.
Yeah. Okay, it's we're at the top of the hour, so we need to close. We're just going to take a minute or so to just go around the panel and ask you, what headline would you like to see us write? Stan.
Proposed Medicaid cuts would devastate America.
Oh, that's a really good one. Joan?
Medicaid cuts would harm communities and the politicians who voted for them.
Okay, all right. Joanne?
Medicaid cuts would harm everyone.
Simple and straight to the point. Anthony?
How proposed Medicaid cuts by Congressmember X would impact this community.
You would go local. Okay,
nice.
Great. Well, thank you so much. Thank you so much to all of you for this great briefing. It was very clear. Everything was really well explained. And to our colleagues for coming to the briefing today and covering this. We'll see you next week.